At the Mass General Cancer Center, we have two unique centers that treat rare malignancies. They are the Centers for Sarcoma, because only 1,300 cases are diagnosed each year, and Chordoma, with even a smaller number, 300 cases in the United States. That means these patients need a multidisciplinary team that are experts, that just focus every day on sarcoma and chordoma.
You need a team of other orthopedic oncologists. You need radiation oncologists, medical oncologists, pathologists, thoracic surgeons, plastic surgeons, vascular surgeons. They're critical to the work that we do. Mass General is a unique hospital because it has all of those things in spades.
We work in an environment where we have access to the most cutting-edge tools. It's almost science fiction, what we can do sometimes. We use proton radiation, we have cutting-edge surgeons, we have drugs that no one else have even heard of. We can do fancy genetic engineering in tumor cells as well as in immune cells.
Nowadays, in order to make the correct diagnosis, we oftentimes need ancillary testing tools, including using these immunohistochemistry stains that we can use to highlight certain proteins to confirm the diagnosis for sarcomas. And also, increasingly, we use molecular testing by sequencing the tumor's DNA, RNA, to allow us to derive the definitive diagnosis for sarcomas.
Once the diagnosis is made, the multidisciplinary team of experts will discuss each patient individually, because just like no two individuals are the same, no two sarcomas or chordomas are the same because of our genetic makeup.
Cancer is very difficult. We don't need to make it more difficult for the patients. We just have to, every treatment, every visit, try to make it easy, and especially do it if it's necessary.
A treatment plan is outlined, and then the team will meet with the patient. And honestly, the patient has input in the final decision. Many patients may just decide on radiation only versus radiation and surgery, but the patient is an integral part of the decision-making process.
There are different forms of radiation that we've pioneered, ranging from proton therapy to intensity modulated radiation to brachytherapy. These are used in different sarcoma diagnoses based on the location of the tumor and the critical organs nearby, and we choose among them to optimize treatment for patients.
Sarcomas span anywhere from infants to older patients. They're particularly predominant in the adolescent and young adult population. So I think when you have a sarcoma that can be seen in kids or adults, it's wonderful to have the same group treating both, because they're so rare and you gain more expertise by seeing more patients. And I think that's something that's very special and unique about Massachusetts General Hospital and the sarcoma team.
So with access to all of this technology, we're also a very friendly and intimate mom and pop operation. And I think our patients really feel that small family environment. And so even though you're coming to this giant hospital with access to the best technology in the universe, you're also seeing individuals who are really caring and friendly and will care for patients, one patient at a time.
No matter what stage you are in your journey, whether it's the initial diagnosis, undergoing treatment, survivorship, or even if you develop metastatic disease, this team remains with you. Follow-up is 10 years, so we become very, very close to our patients. We have seen babies, we've seen graduations, we've seen weddings, it just goes on and on.